So from the side, a really good squatting pattern is as much as my hip goes back, my knees go forward. So it's that kind of motion here. A poor squatting pattern is the knees go forward and then this starts to go back, puts pressure in the knees straight away, unless that's what you're wanting to train, which is an okay thing to train. It's not good if you have knee pain or problems already though. So we want, as soon as you start, your backside go back, the knees bend. So there's a hinging, a bending from the hip. So the back has got what's called arrow spine. If I don't have arrow spine, it's this. The body locks into this arch position. This is the hip flexor dominant pattern. People usually have knee problems and back problems, sacroiliac joint problems. When there's this, before you even squat, the body goes, I'm going to use hip flexors. You can't even breathe properly. The diaphragm's not acting properly. Other one is people don't know how to hinge from the hip. So there's a bend. See how I'm rounded from here? That's not hinging, that's actually moving from my lower back. And then I'll overload your back. If you put weights on your back, doing back squats, you'll blow out a disc. So a really easy way to do this, much as the hip goes back, knees go forward. So you get good at that, which means that the weight stays right in the midfoot. The weight of the foot stays through here. The weight of the whole body goes through this point here. Or you get the weight plate as you sit back. See how the pelvis, it goes back as you reach forward. It naturally makes this pattern happen. So that's another way you can train that. So I'm popping this between. Imaginary weight. Grab a weight for real though, if you need. And we're doing sets. Squats is such a useful pattern to do when you're training squats. You're training your neurology to go all the way down to the feet. The brain loves squats, the cardiovascular system, the heart. Getting strong in the legs is really, really important. The idea is it's making the heel dive inwards, and this one underneath here is making the front foot do this, back foot does this. So there's a movement in the midfoot, this section here, forefoot, hind foot, midfoot. We want that part to twist, and that's where the pronation will be.